Good evening, everybody. I'd like to call to order the February 27th, 2023 Community Mental Health Full Board Meeting. We'll start with the pledge. Please rise. Next will be the reading of the mission statement by Megan.
Our mission: Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Next item is the adoption of the agenda. I'll take a motion to adopt.
So moved.
Motion from Megan, support from Ryan. Questions, comments on the agenda, changes? Seeing and hearing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak? Give us your name. You have 3 minutes-ish.
Hi,
Go
I'm
ahead.
Nancy from Liberties Incorporated, and I'm here to report. January, our beginning balance was $16,985.89. Our ending balance, January 31st, was $49,748.96. Our savings, we've only got a small savings. It's $36.56 and 13 cents, but it's better than nothing, I guess, right? The board and I have discussed wanting to move our building and have a central location for our members, because we've got the 2 locations, and quite honestly, the one down in Roseville is getting pretty bad. There's been a lot of drugs, alcohol, fights, stealing, different things going on at that one. And we've been thinking about this for quite some time, but that's something that we would like to do, so that's on our agenda. So we're looking for a realtor. I found somebody, she hasn't called me back, but it was through Anton Sowerby and Associates, and her name was Debbie Boone. That's the first person that I've been able to contact so far, and I've been waiting for a response from her. November, we had a dinner for the vets, which was nice. We didn't have a good turnout, but it still was nice. We were able to get it out there for next year. So next year, hopefully, we'll have another vets dinner, and it'll turn out better. Trinity Lutheran had donated $300 for us to do that, so that was really nice. In December, we did the Sterling Christmas, which is at Dodge Park. Our members that did come, that did join us, once again, it wasn't a big turnout, but that was all right. The people that went really enjoyed it, and then they come back and they talk about it to everybody, so it does make a difference, you know. So that was really nice. We possibly have 2 board members. We've got to go through the procedure, which I've got to check back with Bruce about, on how I present it to the board. I think if I'm not mistaken, I have to run a background check first of all. But I got the applications filled out, and I've got that form that I needed their signature saying that that was okay. Both of them are members of Liberties. I have gone through job descriptions and clarified them. I went over them with Bruce. Bruce gave me the okay because we had a very vague job description for Liberties. It was pretty much sit on your butt and no, I'm teasing. It wasn't real thorough, so I did go through with the help of a few people and created new job descriptions. Last but not least, I just wanted to let you guys know that we closed Liberties for, I think it was a week due to COVID at the end of December. And that's all I really have. I just wanted to say thanks, a big thanks to CMH and also to Recipients' Rights. I didn't even tell you guys about that. A bike of ours got stolen, and Kendra, I was speaking with Kendra about it when she came to the office to see it and to give us a little background discussion. And I was explaining to her that our bike got stolen. Well, they ended up coming up with 4 bikes for Liberties with locks. So we're gonna still be able to have our raffle that we wanted to have to encourage participation. So that's it. And last but not least, I really want to thank Bruce. Bruce is great. Thank you.
Thank you. Bruce is all right. Anybody else? Anybody else hearing in the public? Anybody else wishing to speak? Bruce? No? Okay. We'll close the first hearing of the public. There's another one before the end of the meeting. And we'll move on to item 5A, minutes. I'll take a motion to approve minutes of the regular meeting of the CMH Full Board held on Monday, January 30th, 2023.
So moved.
Motion from Dana, support from Selena. Questions, comments, changes to the minutes? All right, hearing and seeing none, all in favor signify by saying aye.
Aye.
Aye. All opposed? Minutes are approved. Next is item 6A. I'll take a motion to approve the minutes of the CMH Program and Budget meeting held on Thursday, February 9th, 2023. Motion from Donna, support from Lori. Questions, comments, changes to the minutes? Okay, hearing none, all in favor signify by saying aye. Aye. All opposed? Minutes are adopted. Next is item 7, request to approve. All of these items were discussed at Program and Budget. So I will take a motion to approve items A through I. Motion from Dana, support from Selena. Questions, comments on any items? Mark? Go ahead. This one is not this is for them to enter into discussions for a contract. And then when there is a contract, it will go through the normal process of legal and then coming before this board. So this is just basically permission to go into conversations, contractual conversations, but we will see the final product. Thanks, Mark. Anyone else with questions, comments? Okay, we have a motion and support for A through I. All in favor, signify by saying aye. Aye. All opposed? Motion passes. Item 8, receive and file. No items this evening for that. Number 9 is resolutions. We have no resolutions tonight either. So we'll move on to number 10. I'll take a motion to approve the bills.
Support.
Motion from Mark, support from Megan. Questions, comments on the bills? Okay, all in favor signify by saying aye.
Aye.
Aye. All opposed? Bills are paid. And now we will turn to our interim stand-in CEO, Tracy, for an update.
Hi, everyone.
Hi, Tracy.
I'm your last-minute fill-in, so that's my disclaimer. But in front of you, I did put in your desk there, we're very excited that we have reserved a place, and this is just like a wedding. We put a deposit down, so it's official. We are having our first annual awards and recognition ceremony, and if you notice at the bottom, it's a celebration that honors local mental health champions in categories like outstanding self-advocate, provider or caregiver, community partner, and advocate. So basically, we want to create a system in which our providers and the community can nominate individuals, whether it be the person served or whether it be a provider or advocate or whatever it is, and we want to publicly acknowledge them for their good work. The next step, outside of you making sure that you put this in your calendar, right, because we'd love for you guys to be a participant of this event, is we will be sending out this save the date that you see to lots of other individuals. We'll then create an online kind of a nomination process that people will go through, and we'll update you throughout the process. But for now, if you could again put it on your calendars. If you notice, it's at Macomb Community College on the 18th of May. The other quick things as events, just to bring your attention to it, I think I shared the newspaper article, but we did participate in the wellness fair that was in Richmond at Richmond High School. We also attended in the Macomb Black Business Fair not this Saturday, but the previous Saturday. We're also have an event coming up with Lift a Child to share services information to that particular organization. And if you didn't notice it, I think I shared it, or it's in this workforce update. We also were an event last Saturday to support anybody impacted by the MSU tragedy, and it was a partnership between CARE and the ISD. So in case you didn't notice that. The last thing I want to draw your attention to, you'll see it in our workforce updates, but we post it on Facebook, LinkedIn, and we'll continue to post it on our website. As you know, re-enrollment for Medicaid is being required soon. So we haven't seen any, I don't know if you guys I haven't seen a ton of advertisements yet. So, but we have shared the limited information that we do have available on all our public outward-facing options. And that's all I have.
Thanks, Tracy. Questions for Tracy? Comments? Dave should be back for our next meeting.
That will be the goal.
God willing. We'll also get a financial update at the next meeting as well. They're pulling some more information together that they didn't quite have ready for this meeting, but we will have it for Ryan's program and budget meeting. All right. Piece of cake, Tracy. Thanks. Now we'll move on to other possible agenda items, to the QAPIP presentation from Stacy and crew. And we don't have a PowerPoint presentation, and it's not their fault. There's no laptop there to give a presentation, so go ahead, Stacy.
Good evening, everybody. As you well know, I'm Stacy Coleman. I'm the Chief Quality, Compliance, and Privacy Officer, and I have brought with me today are two of our quality administrators who have recently grabbed these two young ladies, and I found out our third quality administrator accepted the position, so we actually will be evened out. Megan has been with us since August, since September, and Brianna actually served as our policy. So she is now for us. And to start out, we reviewed the quality assessment process improvement plan with you last year, and you approved it. I will introduce you to the author, who actually, Brianna, the state, as well as we received feedback advisory group or HSAG. We've been asking them for some technical. We figured we might as well go to the source instead of essentially just reading this contract attachment. And so I'm going to let. Their PowerPoint was really fun, so we can email it to you if you like.
Yeah. Thank you, Stacy. Again, my name's Megan Carafa. It's nice to meet everybody. I'm going to just touch on the QAPIP evaluation document, and then Brianna will give you the overview of our narrative and our work plan. So the QAPIP stands for the Quality Assessment Performance Improvement Program. So the QAPIP evaluation document is completed at the end of each fiscal year to provide a high-level overview of accomplishments and highlights from the previous fiscal year. So the one that is in front of you is from 2021 to 2022. So it's kind of a look back. The QAPIP evaluation also captures key information that identifies whether current systems, programs, and processes are providing desired outcomes for the individuals that we serve. So the evaluation considers analysis and trends in service delivery and health outcomes over time, and includes monitoring of progress on performance goals and objectives. This evaluation that's in front of you again touches on the following key areas that are outlined and guided by MDHHS's QAPIP standards, as well as incorporating NCQA regulations as we're working towards getting that accreditation. So the areas that are included in that report are key performance indicators, performance improvement plans, critical incidents, our behavior treatment plan review committee, or BTPRC, member experience, which is from the customer satisfaction survey, clinical practice guidelines, credentialing and re-credentialing, verification of services, utilization management, network monitoring activities, areas on vulnerable individuals, long-term services and supports, which is LTSS activities, and then the 2022 improvement initiative. So that kind of gives the things that we had been working on previously. The improvement initiatives are highlighted within the QAPIP evaluation at the end portion, more in like our rock format that we utilize. Preparation towards NCQA accreditation, access to care, putting people first, and diversity, equity, and inclusion. So we wanted to kind of just start with the evaluation portion of what we have done previously, and then move it into, Brianna will kind of overview our narrative and our vision moving forward into 2023 to 2025.
Good evening. My name is Brianna Zakowski, and as Stacy mentioned, I am the Quality and Policy Administrator here at MCCMH. So we're going to transition now into the QAPIP narrative. This is a very large document, and it really gives an overview of the quality improvement program here at MCCMH. And the four main areas to kind of review as you're looking through it. The first one details the scope of work. So the scope of work that the quality improvement program does at MCCMH and where we're taking it moving forward. We have something developed called the quadruple aim. The quadruple aim is going to ensure adequate accreditation status for both our PIHP level and CMHP level. And essentially that's going to be through NCQA and through CARF. And as we navigate that, that's ensuring quality of care standard that's higher. That's actually the highest standard that we can through NCQA, and in that process, ensuring all of our practices are up to par in that capacity. The other two parts of the quadruple aim have to do with member satisfaction and provider satisfaction. So again, improving the quality of care across the agency that we're able to deliver. The second area is the area of focus. So it's going to detail all the various areas that Megan just touched on in our evaluation. Now we're taking them moving forward. So over the next 2 fiscal years, where we're going to take those 13 designated areas that the state gives us and how we're going to structure activities to improve across the board in those 13 areas. The third area is the structure of the quality program. Under NCQA, we really do see an interesting new advancement toward both internal and external collaboration. So within our agency, quality and clinical divisions are going to work much more closely together in order to develop new initiatives, assess where we're at in terms of quality of care currently, as well as external collaboration. We're going to bring practitioners into the quality committee to get insight, to get feedback on if the initiatives that are proposed and enacted are really meeting the needs of our community. So that's the structure, and there's a lot of detail on that in the committee and the subcommittees in that narrative. Then we talk about tools and models. Essentially, how does the quality program, how does the quality department evaluate the effectiveness of our programs, as well as develop initiatives moving forward. So that's a very brief overview of a very large document. And again, as you have questions or any feedback, we'd love to hear it. The last set of documents in there is the QAPIP work plan. And this is my personal favorite of the documents. If I have a favorite, this would be it. This is really a roadmap of where we're going in the next calendar year. This has defined goals and objectives. It has planned activities associated with each goal and objective. And it really does show accountability as well. Who owns this area? So moving forward, not only are we improving in collaboration, but we're improving in that accountability aspect as well. I will say we view this very much as a living document. We want to be updating it as processes occur, as obstacles are identified. This really is a work in progress that we, along with the other divisions that are incorporated in this, will continue to work on moving forward. So that's the work plan. So we have our evaluation, the narrative, and the work plan. And at this time, we'll open it up for any feedback or questions that you may have as you look at the documents.
You guys read it all already? Good questions? Yeah? Ryan, go ahead.
No, Ryan, we did that last year as well. Unfortunately, we weren't able to realize that many of the activities due to short staffing.
Okay. I really like the measurable, and if you can manage something, you can measure it, you can manage it, right?
Correct.
People saying, and also you have someone who's responsible too, so we know.
We want to be very transparent with it, to not just talk about it in committees, but to be transparent. The entire document with our service provider network and all the rest of our stakeholders.
Thanks, Ryan. Donna, go ahead.
Or can I just talk? I don't, is it on? Okay. I don't have a question, I just sort of have a suggestion. And I know whoever brings this to us next year, could we possibly get it ahead of time? Because it's hard to have a question since we haven't read it. I think it would be a lot better if we got it like ahead of time so we could review it beforehand. Because I probably would have a lot of questions if I had read it in advance. But, you know, it's kind of hard. I'm trying to listen and read it at the same time, and it's hard to multitask like that. So if we could get it in advance, you know, when we get our packet, it would probably be a lot better for us to be able to review it before we have the meeting. Just a suggestion. Thank you.
Thank you, Donna. And Sandy is sending it to all of us now, the PowerPoint and everything.
I know it's a lot of document to
Oh,
send, but
I'm sorry. She's not sending the PowerPoint. Stacy's going to send us the PowerPoint, right? Thank you. Megan, go ahead.
I just wanted to say, yay, congratulations. I'm sure Stacy's super excited to have you, and we are too. And thank you for the wonderful presentation, both of you. And Stace, of course.
Yes, thank you. And I just want to echo what Ryan said too. I mean, this is all measurable. I mean, this is all right in front of you, black and white. Like, these are the numbers. This is what we're doing right. This is what we're not doing so well. And this is what we can improve on. I mean, this is fantastic. So I appreciate all the work that you're doing, and we do as a board as well. And we will probably have more questions once we take a look over everything.
Feel free to email any questions you have relative to it as you go.
Thank you. Anybody else? Any other board members with questions, comments? Nothing? All right. Thank you so much.
Just one last piece of feedback. I wanted to thank you all for allowing me to serve county. This will be my last board meeting with you. I'm leaving the agency hands of my two administrators, and again, we've been able to hire some folks, but I appreciate the time, energy, and effort.
Stacy, thank you for all of your hard work. I know you did a lot. Your title just kept growing and growing as your time here continued on. So thank you for everything. I know you've sort of launched us into where we should be. And I can't thank you enough for all of your hard work. And when I heard you were leaving, I was shocked and sad. But thank you for everything, Stacy.
You're absolutely on the right track, and I think with these young ladies as administrators.
Thank you. All right, on that note, a couple reminders. Oh, you need it approved? Well, then. Motion from Ryan, support from Megan. Any comments, questions? No? Okay. All in favor signify by saying aye. 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 All opposed? Now it's approved. Thank you. Now we'll move on to some reminders. We have our March program and budget meeting, hopefully back on Wednesday, March 8th at 6 o'clock here. Full board will be Wednesday, March 22nd at 6 o'clock here. Also, Dave will be presenting to the Board of Commissioners on Wednesday, March 8th here at 3 o'clock, just to give a general update on community mental health services, what we do, what we're doing in the community, things we're improving on, all that good stuff. So just a general update, and then the next day on the 9th will be applicant interviews for CMH board members at 3 o'clock here as well. Any board members with anything else to add? No? Okay. We'll move on to the final hearing of the public. Bruce's last chance. All right. With that, I will close the hearing of the public. We'll take a motion to adjourn.
So moved.
Motion from Megan, support from Lori. All in favor?
Aye.
Mark says no. Everybody else says aye. We are adjourned. Thank you, everyone.